Okay, I'm not sure where we left off, but to receive a certificate of completion for this program, including one nursing contact hour, the registrant must log in, view the entire program, and complete and submit an evaluation. And those who do view the entire program and complete the evaluation will receive a certificate of completion within 2 weeks. And now I'd like to introduce to you Dr. Tia Welsh. Dr. Welsh is chair of obstetrics and gynecology for Valley Health System. She has a long track record of leadership within women's health, and she can often be seen speaking on various topics dealing with obstetrics and gynecology, as well as advocating for the rights of all birth people. So thank you for joining us today, Dr. Welsh, and I think you have control of the meeting, so we're looking forward to your talk now. Thanks.
Thank you. Thank you. It's a pleasure to be here. I am going to share my screen. Is that good? Everybody can see my screen? Perfect. As Dr. Schwab said, I'm Dr. Welsh. I am the chair of obstetrics and gynecology for the Valley Health System. And today I was asked to give a lecture on vaccines during pregnancy. I wasn't sure of the audience, so some of this may be repetitive to information that you already know, so bear with me. I did this for a wide range of an audience. Today, my objectives are to really just hone down and understand the need for immunizations, for everyone to get to know the best time to get immunizations during pregnancy, as well as distinguish who should obtain immunizations during pregnancy as well. So to vaccinate or not to vaccinate, and why are vaccines so important during pregnancy? There are only 4 vaccines that are recommended during pregnancy. Those are flu vaccine, Tdap vaccine, COVID vaccine, and now RSV vaccine. And if you listen to those vaccines, these are all vaccines that prevent respiratory illness. Flu can cause severe respiratory illness. COVID causes respiratory illness. RSV causes respiratory illness. And when we're getting Tdap, we're trying to prevent more or less pertussis, which can be severe in neonates. Why do pregnant women need immunizations? Well, as the growing fetus in the womb gets bigger, so does the uterus expand and elevates the diaphragm. As the diaphragm gets higher, you have less lung capacity, and that increases your oxygen usage. You have a higher respiratory rate, and there's an increased amount of air breathed in and out. In addition, the anemia of pregnancy causes less oxygen capacity. So what am I saying? I'm really focusing on the respiratory system of the mom as the 4 recommended vaccines during pregnancy are to prevent respiratory illness. When we have a higher diaphragm, less lung capacity, any respiratory infection in a pregnant woman is going to render her with more severe symptoms and more risk for hospitalization, for pneumonia, for intubation. Again, why is this necessary? We have decreased lung capacity, and we want to protect mom, as some of these vaccines are dedicated to prevent illness in the mom. But in addition, we want to prevent illness in the neonate. So passive neonatal immunization is extremely important. The first 2 to 3 months of life are vaccine-free, is a vaccine-free period for that neonate. The only immunization for the first 2 to 3 months is either from passive immunization or via antibodies through breast milk. I have a really short clip just to show some of the things that I just discussed.
The lungs are the primary organs of the respiratory system and are responsible for taking oxygen into the body and expelling carbon dioxide. By the end of 9 months of pregnancy, a woman's ventilation, or the amount she breathes every minute, increased by up to 50%. This increase in ventilation is stimulated by the hormone progesterone, which simultaneously increases during pregnancy. While much of this increased ventilation is due to a quicker pace of breathing, during pregnancy each breath becomes a bit shallower as a result of the growing baby. As baby grows, the uterus pushes upwards on the mother's diaphragm and lungs. In fact, the baby can shift the diaphragm upwards by as much as 4 centimeters. Combined, this results in quicker, shallower breathing. In fact, many pregnant women become breathless even at rest, but this is completely normal and should not be a cause for concern. The adaptations don't end there. Progesterone and a hormone called relaxin cause the ligaments of the rib cage to become more relaxed. This allows the lungs to fill with a greater volume of air as the rib cage can move through a greater range of motion. Amazingly, these normal adaptations to the respiratory system reverse soon after the baby is born.
I thought this was a really great pictorial and video to show the respiratory system of the mom during pregnancy and how it adapts and readapts afterwards. But why I stick to the respiratory system of mom. When I said that the first vaccines during neonatal or newborn life is at 2 months, that deals with the respiratory system, we have DTaP, which is given at 2 months, which again is for pertussis. And we don't, and I'll go over this later, but we don't even see the flu vaccine until 6 months of life. So again, that passive immunization for a baby is extremely important as we look at the immunization schedule of newborns. So let's talk about that Tdap vaccine. The CDC recommends that all women during pregnancy receive Tdap during the 27th through 36th week of pregnancy, preferably during the earlier part of this time period. And that's because it takes about 2 to 3 weeks for that passive immunization to occur. So giving it during this would be at the 28th week, we're talking about the 3rd trimester. We want to give it during the 3rd trimester to boost the immunization of the fetus at that point, so that the baby's born with some antibodies towards pertussis. Now, why is this important? Pertussis in infants less than 6 months can cause severe coughing, gagging, gasping. It can cause pneumonia. And this is really severe in a neonate that barely has enough immunization or antibodies or defense mechanisms to prevent some of these things. And this is going to require, at some times, hospitalization. Getting Tdap between the 27 through 36 weeks of pregnancy lowers the risk of whooping cough, which is caused by the pertussis virus. And antibodies, again, are highest 2 weeks after vaccination. And it's recommended for every pregnancy. So if a mom was 30 weeks in January of 2004 and receives that Tdap vaccine and winds up pregnant again during the same year or the following year, yes, the requirement again is to get that vaccine, because one, we're really looking for the passive immunization of this vaccine for the neonate and less to do about the mom. I do have the pertussis incidence by age group from 1990 to 2021, just to give some perspective of what we're dealing with. And as you can see, there was quite a spike in those less than 1 year old between 2010 and 2012. And with the the adage of this vaccine during pregnancy, we've really seen a decrease. And I plan to show that in some of the other vaccines as well. But then people will say, well, why should I get a vaccine? What are the adverse effects? We're talking about pain, fever up to 24 to 48 hours, headache, fatigue, stomach ache, nausea, vomiting, and diarrhea. I think these symptoms, when you compare them to the adverse effects on the neonate, as I explained, pneumonia, possible intubation, coughing, gagging, gasping, I think the symptoms of the vaccine outweigh the adverse effects of not receiving the vaccine. So then we talk about the COVID vaccine. COVID is still around. And COVID is recommended for pregnant individuals who have not previously been vaccinated. Pregnant individuals may receive COVID vaccine during any point in time during the pregnancy. However, Moderna and Pfizer vaccines are preferred over the Johnson & Johnson vaccine. There were evidence and research that showed that there was an increased rate of blood clots with Johnson & Johnson vaccine. And pregnant and recently pregnant people up to 6 weeks postpartum should receive COVID-19 booster, dependent on the completion of their last COVID vaccine. Again, the COVID vaccine is for protection, not just of the neonate. Now we're talking about protection of the mom as well. With all of the respiratory conditions that I explained occur during pregnancy, moms succumb to COVID, pregnant moms succumb to severe COVID symptoms much more easily than a non-pregnant female. COVID illness can also increase the rate of preterm labor and even stillbirth. We are talking about, and in neonates, we're talking about fever, decreased wet diapers, decreased eating, increased work of breathing, coughing, and diarrhea. So I'm explaining the symptoms that moms and babies get with the COVID illness, as opposed to what are the symptoms of the COVID vaccine to mom. Again, we see headache, fatigue, muscle pain, swollen lymph nodes, and a sense of feeling unwell. This does not mean that the vaccines are producing the illness, as opposed to the symptoms of your antibodies now fighting and the never seen before inactive virus that some of these vaccines, or the activation of some of the antibodies from these vaccines. RSV, respiratory syncytial virus, that's also a vaccine that has been newly approved for pregnancy. Moms may feel cough, runny nose, fever, sneezing, and wheezing for up to 2 weeks. And again, we're preventing some of these respiratory illnesses in mom. But again, RSV vaccine is less for mom as opposed to the passive immunization for the baby. And thus, this is another vaccine that is given in the 3rd trimester, preferably 2 weeks prior to delivery. According to the CDC, infants and people over 60 can develop severe disease. There's been 1 million visits to a healthcare provider among children younger than 5, 58 to 80,000 hospitalizations among children younger than 5, and 100 to 300 deaths in children younger than 5 every year. Again, I wanted to put some perspective on the prevalence of the disease itself. And what I'm showing in these graphs, and I apologize that they're extremely small, but for the tri-state area, which I consider New Jersey, New York, and Pennsylvania, just going back, this ends around midway, the beginning of November. But if we go back all the way to 2022 of January, we then see week by week progression of the illness, RSV, and then we start to see the spike in September. Again, I'm sorry, this is 2022. We see the spike in September, and it tends to wane around the middle of January. The graph ends at October, and we start to see an uptick again that will last again until approximately the middle of January. So the RSV vaccine is not given at any point in time during the pregnancy, but only between 32 to 36 weeks, and only between the time frame of September to January, because that's when we see the greatest spike in this disease. Again, who gets the RSV vaccine? Well, adults over 60 get the RSV vaccine. Babies can get the RSV antibody. All infants entering or born during RSV season should get the antibody. And babies, again, can get those antibodies if a mom was given 2 weeks prior to delivery. They are not in need of getting it upon birth. However, what we're seeing right now is that there's a severe shortage of the antibody in the pediatric population. Even in my hospital currently, we have a shortage of the doses for our neonates. So what does that mean? It's imperative that pregnant women get the vaccine to give that passive immunization to their babies. Because if a mom is delivering between September and January, that baby should be protected for at least 8 months. Without vaccinating those babies, they can succumb to severe illness after birth. Again, what are we talking about as far as side effects of the vaccine? The same side effects that we talk about, most of them: fatigue, fever, headache, nausea, and diarrhea. And most of these symptoms only last for about 24 to 48 hours. Influenza during pregnancy. Influenza, also known as the flu, is spread through air and through contact. Pregnant women infected with the flu are more likely to get pneumonia. Similar to COVID-19, they can go into preterm labor. And flu from the flu can actually cause birth defects and neural tube defects. The flu vaccine can be given at any time during the pregnancy. So first through third trimester, and usually flu vaccine is given during September through April. According to the March of Dimes, the following 3 medications have been approved during pregnancy for treatment of influenza. Those are what we know as Tamiflu, Relenza, and Rapivab. Tamiflu is the most common medication and usually given the first 48 hours of symptoms. It is, again, a danger to the fetus to have a pregnant mom with high fevers for a prolonged period of time. High fevers more than 102 degrees can again produce neural tube defects and birth defects, especially if those fevers are in the first trimester of pregnancy. Influenza vaccine effectiveness in preventing influenza was a retrospective study of 2 million pregnancies during a 6-year period. This study showed evidence that influenza vaccine reduces the risk of mild to moderate severe disease during pregnancy. It also showed evidence that maternal vaccination offers secondary protection to infants during the first months of life. This was one of the biggest studies to prove the effectiveness and necessity of the vaccine. Just to give you a little perspective about the flu vaccine, during the season of 2010 to 2011, we estimated that there was 21 million symptomatic illnesses from the flu, 10 million medical visits, approximately 290,000 hospitalizations, and 37,000 deaths. This was also around the time that the flu vaccine campaign came out as well. And 10 to 11 years later, from 2021 to 2022, that 21 million became 9 million. The 10 million medical visits became 4 million. The hospitalizations went from 290,000 to 100,000, and the deaths significantly decreased from 37,000 to 5,000. If this doesn't encourage vaccine uptake, I don't know what does. So, I apologize. With only half of pregnant moms getting their flu shot, too many people remain unprotected still. Flu shots help protect pregnant women and their babies. During the 2016 and 17 flu season, an estimated 50% of pregnant women protected themselves. But we can absolutely do better. If you were pregnant, this was a big ad during that time that said if you're pregnant, it's recommended at any time. You can reduce your risk of getting sick from flu. You can protect your baby. Many people say, hey, but the flu vaccine gives me the flu. There's been no research that has shown that the flu vaccine or any vaccine gives you the illness. Will you feel sick? Yes. You may feel malaise, you may feel cough, but those are between 24 and 48 hours worth of symptoms as opposed to a prolonged 7 to 10-day course of illness. Again, I just want to point out, and I'm going to show this slide again, why do pregnant women need immunizations? I mentioned it earlier, the flu vaccine is first given at 6 months. It's first given at 6 months. If your baby, especially if your baby is born during the flu season, even if your baby's born during the summertime, it will take them through the flu season. It is important to give your baby the best care and the best chance during those first couple of months through passive immunization. Again, I talked about, does it give you the flu? No. You can have some soreness, redness at the point where you got the injection. It can produce mild fever, muscle aches, and nausea, but this is not the flu. This is your body reacting to the inactivated virus. So how do we get people to know the facts? If you get the flu or COVID-19 during pregnancy, you need to let them know that you get much sicker than non-pregnant patients, specifically because the adaptations of your respiratory system, and it could cause hospitalization. It could cause intubation. Babies younger than 3 months have the highest risk of severe disease and death from whooping cough, and babies are usually not vaccinated prior to 2 months of age. Getting vaccinated during pregnancy will not make you sick. I repeat, it will not make you sick from the illness, but it can make you feel ill, but not as ill if you didn't have the vaccine. So people want to know, well, how safe are these vaccines? Vaccines go through clinical trials, usually they start with a phase 1 where it's usually less than 100 healthy volunteers. And they determine, is it safe? Does it work? And are there serious side effects? Some of those questions, once those questions are answered, they go to phase 2 and they recruit more patients in the trial to see, again, what are the most common short-term side effects? And are they responding to the vaccine? Then we get to phase 3, which are hundreds of thousands of volunteers. And again, looking at who didn't get the vaccine and comparing them to who did. Again, is this vaccine safe and what are the side effects? And is it effective? If all of those questions are answered in a positive manner, then that's when vaccines are put out there on the market. But it doesn't just stop with clinical trials. Just because 100,000 people say it's okay, some people are still not convinced. So after the vaccines are put out there, we still have a host of different layers of protection. The vaccine adverse event reporting system is a reporting system that reports any adverse event. Physicians and hospitals report adverse events to this system so that we can all look and make sure that we're not seeing serious adverse events. But then the vaccine safety data link, which is overseen by the CDC, monitors the safety of vaccine and does studies about the rare serious adverse events that they're getting from the vaccine adverse reporting system. But it doesn't stop there. The FDA oversees the post-licensure rapid immunization safety monitoring. What does this mean? They use databases from health insurances and they learn to identify possible safety issues. And then the CDC also collaborates with a bunch of health networks with the clinical immunization safety assessment to report research done on the safetiness of all these vaccines. So between the CDC and the FDA, they're all they're researching even after the vaccine is let go into the public. And then again, the FDA absolutely monitors how vaccines are manufactured and making sure that there's quality and safety in that. With all of these layers of monitoring between the CDC and the FDA, again, for some people, that's not enough. But in the meantime, we're preventing disease and we're looking and we're monitoring. And that's why Johnson & Johnson, we knew maybe less than 6 months that there was an increased risk of the Johnson & Johnson COVID vaccine increasing the rate of thromboembolism if it wasn't for these specific monitoring entities. So again, when do pregnant women need immunization? For COVID-19, this is any trimester, first, second, and third, at any point in time during the year. Tdap is specific for the third trimester, usually between 28 to 32 weeks at any point in time of the year. The flu vaccine is given during all trimesters during September to April during high flu season. And the RSV vaccine is given again during third trimester during high RSV season. The ones that are given during the third trimester are specifically for passive immunization. So I hope that I have proven just a little bit that immunizations are safe and effective way to protect both mom and baby from disease. Some immunizations are recommended before you become pregnant. Those vaccines could include HPV vaccine, MMR vaccine. Those are recommended prior to pregnancy, even varicella vaccine, and others during pregnancy. So I hope that this answers some questions, gives you some enlightenment as to the whys behind a lot of these campaigns. And I will take any questions at this time.
Thank you, Dr. Welsh. That was a wonderful presentation. It really covered all the basics of the vaccines during pregnancy. And I think it was a good reminder for all of us of both the importance of vaccine, and very timely because we're in the midst of, as Emily pointed out, flu is on the rise. We've seen RSV, COVID is still with us, as you said. So I think it's on all of our minds. Can you make, I'm going to open it up to questions, but can you make a few comments about, as someone working directly with patients, some practical suggestions for us of how to get patients on board? You showed that one slide showing kind of trying to motivate patients by demonstrating the importance of it, but do you have any tips for us on how you get your patients to kind of go along with your recommendations?
I usually don't stop at the no. When they decline vaccine, I have a further discussion about the why. Some, believe it or not, is because mom said so. Some, but my friend or I heard. So just dispelling the myths behind the vaccines and the rumors in the community is important. During times like this in the past, prior to these vaccine campaigns, it was not uncommon to have several pregnant patients in the ICU during these months. And that was another way of explaining to patients, I don't think you want to be that one. I think at this point in time, especially with the RSV vaccine and understanding that there is a very limited supply for the pediatric population right now, that is another push to have moms vaccinate at this time as well.
Thank you. Okay. So I see there's one question here from Emily. As an OB, what are some of the most common concerns about vaccines that you hear about from your pregnant patients or their families?
I think the number one thing of concern is autism. Is it associated with autism? Is this going to negatively affect my baby? And there's nothing in the literature to confirm that. And some people just don't want to take the risk. There are very few patients that I haven't been able to convince to do so. But once they've made that decision, usually they will decide later on in a pediatric office whether or not they want to get those vaccines. There are some people that you're never going to convince to get the flu vaccine. Before it was a thing, especially in healthcare, if you didn't, you had to wear a mask. Well, we've all suffered through that, haven't we? So that's no longer a push to get people to do the flu vaccine. However, I think the slides that I presented today have shown how far we've come with these vaccines during pregnancy.
Thanks. And specifically with RSV vaccine, there's a question here. Are you finding that patients are willing to receive the new RSV vaccine, especially now knowing that there's a shortage for the pediatric antibody?
Yes. So our practices over at Valley are giving out the RSV vaccine. I think I would say about 60% of patients were coming in because it's been all over the news, all over the commercials, and asking for it. That 40% that was indifferent, they are now changing their minds because we are letting them know that there is a shortage. And I think that public health has just done a really good job of informing the public about what we're dealing with. If you've been reading newspapers or looking at the news, we do know that there's a severe uptick, especially in the Southeast. So if people are remaining aware, and we are just really encouraging and reminding them of the public health issue that we're dealing with in the country, usually they'll go back. They may not take it the first time, but they'll come back and think about it, and usually they'll take it the second time.
And are you able to give these vaccines simultaneously so people can decide to get it and get them all together at once?
Absolutely. You can get your flu vaccine, RSV vaccine, Tdap vaccine all at once. Some people may not want to do that. And some people just want to get it over with. There's no reason why you can't separate it during that time frame, but there's no adverse effect to getting it all at once.
Great, thank you very much. I don't see any questions in the chat. Does anyone else have any questions they'd like to add for Dr. Welsh at this point? You can either unmute yourself, I think, or put it in the chat at this point. Yeah, Emily?
I think this one might be a little complicated to put in the chat, so that's why I'm unmuting to ask this, Dr. Welsh. We had talked about that this is such a unique situation with the RSV vaccine coming out available for pregnant people at the same time that the pediatric dose for the antibody is coming out. And at the same time, there's this shortage. And so I was really interested in thinking about how this impacts mom's decision of getting, the maternal vaccine versus the vaccine for their baby, if you want to call the antibody the vaccine. And thinking about that like on a wider range of how does this kind of impact like acceptance of maternal vaccination. So, we're always kind of trying to figure out like what is the motivation for moms to accept vaccines, and we do hear that a lot around moms that are pregnant, right? What is the impact on baby? They're very concerned about baby. And so I'm just trying to think ahead, right? So for in the future, when both vaccines are very readily available, do you think that moms will be more accepting of the maternal vaccine for RSV, or do you think that they will want to defer to wait until the baby's born? Does that make sense?
No, I totally understand your question, and that's a good one. When I trained, I won't say how long ago I trained. My kids told me I was born in the 1900s. I was already upset at that. Tdap wasn't recommended at that point all the time. And we give Tdap and say, hey, you're due for your Tdap vaccine. This is going to help your baby. I get probably less than 1% of patients that have ever declined Tdap. However, because it's routine. Once RSV becomes just routine, this is routine, Tdap and RSV, this is for baby. However, when you say it's for baby, I feel as in my years of experience, moms are more acceptant. The flu vaccine and the COVID vaccine, that's for mom, they're a little less hesitant. They're a little more hesitant to accept those. So really playing on the heartstrings of these moms and saying, hey, this is really important for your baby, I think plays a significant role in the behavior of pregnant moms. I hope I answered your question.
Thank you. Let's see. I see a question here. Dr. Schwab, as a pediatrician, do you and your colleagues see a difference in your newborn and infant patients when prenatal immunization rises? So I think for sure we've seen, as your graph pointed out with pertussis, decreases in pertussis in our youngest patients because of the passive antibodies that are relayed to the patients, to the kids from the maternal immunization. So yes, I think this is a really effective way to provide protection for our youngest patients who really, as you pointed out, can't be vaccinated. And we're fully on board with this as a way to protect our patients. Do we have any other questions for Dr. Welsh?
I think I want to end on the fact that not only do we have a shortage of the antibodies for newborns, but I also want to say there's not a high percentage of pediatricians in the community as well that are getting the RSV vaccine, because this is the first season. There were lots of questions about insurance and who's going to pay for it. And as week by week and month by month, insurance plans are popping up and popping up and popping up saying they'll cover it. In addition, there's not a lot of community physicians who are buying it for pregnant patients because of the same reason. And so what some of them are doing is sending patients to the local Walgreens, CVS, and this can be done. So I also want to just give advice when patients are seeking it and the providers around you do not carry it, that you can send them to the pharmacy with a script.
Thank you. That's actually a good idea. And unfortunately, some patients don't make it to that second visit, but I think it is an option that's very, at least available to us. And that's a perfect segue into the next topic. So you're welcome to stay on and listen with us, Dr. Welsh, if you can, because our next speaker is Kimberly Uwe, who's going to talk to us about vaccines and insurance for a few minutes before we get into our coalition update. So if you'd like to stay with us, you can. If not, thank you very much for your comments and your lecture, and we really appreciate your time and your insight. So I'd like to introduce Kimberly Uwe, who's going to talk to us about vaccines and insurance. Thanks.
Oh, would I be able to share the screen or no?
I hope so, Leanne.
Let me see if I can give you access. Just hold on. Okay, I'm gonna make you a co-host. And there you go.
Okay, awesome. Thank you. All right. Good afternoon, everyone. My name's Kimberly, and I'm a pharmacist by trade and a health outreach specialist here for the Center of Medicare and Medicaid Services. And I'm going to make this as brief as possible for you all because I know you guys have a packed schedule. So bear with me. So I'll be covering immunizations in terms of the importance, of course, but then also how they're being covered through CMS's programs. So I do have to say that this is a disclaimer that the information is current at the time of presentation, but the Medicare policy is subject to change. And the contents of this document are not meant to bind the public in any way unless specifically incorporated into a contract. This document is intended only to provide clarity to the public regarding existing requirements under the law. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense. All right, now that's done with, we can get right to it. So, immunizations and the fast facts. So this is our first time where we have the flu, COVID-19, and RSV shots all really being responsible for a lot of hospitalizations. So they are currently being covered, and we're really pushing for people to go in and get these vaccines if they can. So here. So our timeline that we're using per the CDC to get people to get these vaccinations. I know Dr. Welsh went in depth about people who are pregnant, but just to reiterate, if you're seeing patients or you're speaking to people who are pregnant, please let them know to please get their flu shots, start as early as July all the way through August. And for the general public, especially adults that are 65 and older, that would be from September to October. But just keep in mind that, of course, the flu peak seasons are between December to January. So we have here that the ACIP, of course, recommends that adults 65 and older, preferably they get one of the higher doses. So if you're seeing, someone's grandparents or anyone, they're 65 and older, and they're going in to get their flu shot, I just want you to remember the quad. They need to remember quad, so that way they know they're getting the correct vaccine for their age. That means 65 and older. If none of these three vaccines are available enough, then they can ask for a different vaccine, but generally I would even recommend them wait till the pharmacy orders it in for them. Now, with the ACIP recommended vaccines, for those that are under 65, people have the option to get your Afluria, your Florix, your Fluval, your Fluzone, and the last two being Flucelvax and Flublok. You can get those. They were not made with eggs. So some of you may have heard about how some patients have an allergy to eggs, and the vaccine still being made predominantly with eggs. Those are the two that if someone has that allergy, they should get Flucelvax or Flublok. And then here, we of course don't remember all of these flu shots and the numbers. However, this is just to let people know that as it stands right now, we're pretty much covering any flu shot. So from your Fluzone high dose, your Flumist, the Flucelvax, Flublox, the Flurix, Fluval, Fluzone, and like I said, the Flucelvax again, these are all covered. So if you have patient going into the pharmacy specifically, they should be able to get this covered. And as we know right now, all of the Medicaid, Medicare programs, they are covering these. So now Medicaid coverage for adults. Beginning October 1st of this year, state Medicaid and CHIP programs must cover vaccines that are approved by the US FDA for use by adult populations and administered in accordance with the ACIP. Excuse me. And so what this means is that anyone 19 years old or older, and like I said before, the flu is a recommended vaccine and it is covered. Then in terms of Medicaid coverage for children, Medicaid plays a key role in the prevention of diseases through facilitating access to vaccines and vaccine activities. So we're essentially covering all children under the age of 21 who are eligible for the early and periodic screening, diagnostic, and treatment benefit. They all can receive ACIP recommended vaccines at zero cost. The federally funded vaccines for children, also known as the VFC program, provides vaccines as well at no cost to children who are enrolled in Medicaid, who are uninsured, underinsured, or an American Indian or Alaska Native through the age of 18. And you can visit our site. We have a link, which I can share after this presentation. Now, for our COVID-19 vaccine, Medicare and Medicaid programs are also covering the most up-to-date COVID vaccines, that being rather from Pfizer or your Moderna or your Novavax. So if you go to a pharmacy, just know it's covered. And if they're having issues with billing, they can call, but it is covered. And then people, like I said, with Medicare and Medicaid, as well as CHIP programs, private insurance or no health coverage can get the COVID vaccine at no cost or low cost. Now, for our Medicare beneficiaries, once again, those Medicare beneficiaries will not have to pay anything for their COVID-19 vaccine. There's no deductible, co-payment, and the providers cannot charge an administration fee for the vaccination. I know that's come up a couple of times with other beneficiaries I've met, but no one is supposed to be paying the administration fee at their doctor's office or even at the pharmacy. Then if the person is immunocompromised, they can get a 3-dose series of the new Moderna or the Pfizer. What we really, really recommend that wherever they go, they try and complete this series there, just so nothing's thrown out of whack with the sequencing of receiving those doses. And then we also have the free COVID-19 vaccine bridge access program. So the CDC took into account that some people may not still be able to get it, even though there's Medicare and Medicaid. So the bridge access program was created, and it provides free COVID-19 vaccines to adults 18 years and older without health insurance, and adults whose insurance does not, for whatever reason, cover the COVID-19 vaccine cost. So you can get a free COVID-19 vaccine at healthcare providers that federally support these centers, and pharmacies participating in the Bridge Access Program. It's set to go all the way up till next year on December 31st, 2024. And people can access this program by finding providers that offer the COVID vaccine by visiting www.vaccines.gov. Now, RSV. So we do have some vaccines that have been approved and that are covered through our programs. And so Nirsevimab is a new monoclonal antibody product that, of course, is used to protect infants and young children. And it is covered for all infants younger than 8 months born during or entering their RSV season. And then there's Palivizumab, which is also available for children under 24 months with conditions if that person's not able to get Nirsevimab. Now, for adults, the CDC is recommending that adults ages 60 years and older, they can receive a single dose of the RSV vaccine shared, basically, as long as it's covered. And this means healthcare providers should talk to their patients about the RSV vaccination options. So for this age demographic, we have the Arexvy as well as the Abrysvo that's covered. Now, what I've been recommending to people is if they want to go to the pharmacy to get the vaccine, it would be helpful to make sure that pharmacy does have the RSV vaccine there, because I know there's been some shortage issues with getting in there, just so they can at least save the trip. And the pharmacy could also run like a billing to make sure that it is covered, so there's no issue when the beneficiary shows up to get the vaccine. Now, there are some other vaccines that are recommended by the Advisory Committee on Immunization Practices, and that includes the shingles and the Tdap, as well as the hepatitis B and the pneumococcal vaccines. So those vaccines are covered under Medicare Part B for individuals enrolled in the original Medicare plan, and they are not supposed to pay anything. It'll be a zero cost for the beneficiary. And then for other vaccines for children, the Medicaid and CHIP and Marketplace health plans must cover preventive service for children, including ACIP recommended vaccines without cost. And there's also free vaccines that are available and provided under the Vaccines for Children program. So I'm just really trying to keep reminding people that if someone under the Medicaid or Medicare program is going into the pharmacy, either be for themselves or they're going with a child, it's supposed to be covered at no cost. There's no reason for them to have a copay. So if there are any questions, feel free to ask, or if you need any information regarding the immunizations that are covered under Medicare or Medicaid, please feel free to email me. My email is listed here, and thank you all for listening.
All right, I was on. Thank you, Kimberly. That was a good overview of, and it sounds like everybody should be covered for all the vaccines. Do we have any questions? So I have one. Oh, I see Emily's talking. Go ahead, Emily.
Sorry, I have a quick question about pharmacy, that people receiving vaccines at the pharmacy. So you mentioned, VFC program, but at least in New Jersey, most I don't know what the current status is, and maybe Leanne, you do more, but I don't know if there's many pharmacies that are offering VFC. It's usually through pediatric offices or through health departments. And I was also just curious because usually at VFC sites, they are able to charge an administrative fee with the VFC vaccines. I think it's about $25 per dose. So I was curious if there were different rules for pharmacies that are implementing VFC in other states, or if that's happening in New Jersey and different areas.
So if the person's going into the pharmacy, pharmacists, they don't have like a NPI number where they can charge an administration fee. So that's the thing about that. They're not supposed to be charging. Yeah. So like with other programs, or if you go see a doctor, there's more wiggle room in that area, but for the most part, no, in the pharmacy, they're not supposed to be charging an administration fee. If there was a fee, it'd be, let's say someone came in and they had no insurance, and maybe let's say, I'll give you a scenario, like someone has their kid going back to school, but mom just never had time to get them enrolled in Medicaid to get it covered. Then sometimes you'll see a parent pay the cash price for like the vaccine, but those are like extreme circumstances. Usually they're not supposed to. They're not supposed to. And in those cases, we even tell people to save the receipts so that way they can push it through the appeal process, because they're not supposed to pay. Like at this point, we just really need people vaccinated. That's our priority.
And who are they appealing to when they do that?
So if it's, let's say it's a child that beats through the Medicaid process, there's the Medicaid appeal process, and they do ask for the receipt. That's like when you get the patient information back from the pharmacy, it'll show how much you paid, and they'll ask for that proof when you do appeal. And if it's through let's say it's someone that's 65 and older, like a Medicare beneficiary, we have, I can't remember the exact number, but it's basically 1-800-Medicare, and they'll help push you through to appeal that because they're not supposed to pay. I know there's been some people going to independent pharmacies and that happening. So that's why I'm like, no, you're not supposed to be doing that. But yeah.
We've had people that have commercial insurance as well, and they're getting charged for their flu shots. And we have many times where parents will take their kids to VFC sites and even at FQHCs, and they're told that they, depending on how many vaccines they're getting for their child, if it's a catch-up visit, it can be several $100s if you have more than one child for VFC vaccines. So we're always looking for ways that we can help families to better understand what the costs will be for vaccines, because when we talk about VFC, we try to avoid using the word free, because oftentimes when they actually go for their vaccine, they will get charged an administrative fee per dose.
Another workaround is oftentimes like your Walgreens, CVS, they'll have like those school flu clinics, and they usually have vouchers to account for people who don't have insurance. So if you're working with some patients that would be going in, and there's like, let's say in early fall, and you speak with like the pharmacy managers, they can give you like direct information about what their company's also doing, just because sometimes people do get lost in the weeds and it takes time. So that's another option I usually tell people about.
I thought I heard someone else trying to make a question. Okay. Thank you then, Kimberly. And we have your, if you could put your contact information maybe in the chat as well. I saw it on your slides. This way anybody could reach out if they have any specific questions for you. If you'd be willing to take those, they can send you an email.
Thank you.
And thank you for joining us. Appreciate it. Okay, so next on the agenda is think Leanne is going to be talking about the updates from the EMIC working group.
Thank you. I'm going to share my slides. Give me just a second. So if you're new to our EMIC community, you might be familiar, you might not be familiar with our two working groups that we have, and you are more than welcome to join us. We meet quarterly. We have a community education working group, and you can see just an overview of what we've done. So we meet quarterly ahead of each EMIC meeting, and it's a great discussion about what the needs in our community are. Also some opportunities for education as well. So in terms of the community education group, I'm happy to report that the partnership's Melissa Hart gave a great presentation on motivational interviewing during the Adult Immunization Conference in November. That is through INGEN, the New Jersey Immunization Network, and there is a recording of that presentation in the probably the INGEN website. I can provide a link, but it was a fantastic presentation with very practical advice on how to speak to patients about immunizations. There were some video examples there, so Melissa did a great job with that. Also, we are providing in the partnership, our immunization department is providing some professional education around immunizations, specifically around HPV. So we're going to doctors' offices. We can do it in person or virtually, and talk to providers and their staff about the HPV vaccine. Irene talks about what HPV is, what the vaccine is. And then our NJIAS staff comes in and talks about how to track patient immunizations in NJIAS so you can have an informed conversation with your patients about what vaccines are due or past due. You can enter the HPV or other vaccines into the patient record and then run reports to keep track of who's coming up, who's due. We have a reminder recall feature. If you are a doctor's office, if you're giving the HPV vaccine and you're interested in this presentation for your staff, Irene's contact information is there. We'd love to be there again, virtually or in person, to do that presentation. And I will send a link to with her contact information in the notes following this meeting. And again, during our quarterly meeting, our community education working group got together and we identified potential education topics for future EMIC meetings. RSV is a hot topic. Access and education for the community and providers is needed. We also talked about vaccine requirements for refugees, also vaccine requirements for those re-entering the community following prison, Medicaid recertification, and Medicaid eligibility for undocumented pediatric patients. Of course, if you have any ideas for other topics that you think we should cover in the next year, let us know. You can put it in the chat. And again, we'd love to have you at our community education working groups. And just highlighting some other education opportunities that we had over the past few months. We had some webinars. We had an HPV presentation for our Spanish-speaking community. Jasmine Anderson presented about cold, RSV, flu, or COVID to the Newark Board of Ed. And then brand new, hot off the presses, posted this morning is Jasmine's How to Protect Against Seasonal Influenza. You can catch that on our YouTube channel. Again, I'll send out the link, a fantastic webinar that she did yesterday. Then we also have our community engagement working group. Again, we're looking for new members for that. Just a quick overview of our EMIC population here. We currently have 155 EMIC members, 434 newsletter subscribers. And then also in terms of community engagement, we have some fantastic programs. You might be familiar with Protect Me with 3 and Step Up Vax Up contests. Both of those contests are open, and you're going to hear more more about those contests for college students and middle and high school students coming up during our community announcements in just a few minutes. And again, our most recent community engagement group talked about how to expand our EMIC membership and make it more diverse, including inviting faith-based organizations, dentists, LGBTQ organizations, health systems, and dentists are on there twice. I think that meant to be pharmacists. You are welcome as you get new EMIC meeting invites. Please share it with your community because we'd love to expand and diversify our EMIC community to ensure we're reaching everybody in our community. Just some updated resources I do want to highlight. We have our Power to Protect New Jersey flu campaign. The website is there. We encourage you to join our influenza action group where you'll get a newsletter, there's educational opportunities, and a toolkit so you can better talk to your patients and clients about the flu and the benefits of receiving the flu vaccine. The Department of Health did want to highlight a couple of updated flyers that they have. One is for COVID, one is for HPV. And I just got a whole stack of hepatitis B vaccine brochures for your patients and clients, and you can email me if you'd like me to send some over. I'm happy to do that. And just highlighting our community engagement work. Over the last few months, as a result of our community partnerships, 245 people have been vaccinated in our community. That includes COVID and flu vaccines. And we couldn't have done it without our community partnerships. And you can see who we've worked with over the past few months. We had an accessible flu clinic with the Nutley Health Department and the Autism Society of America. The partnership offered 3 flu clinics with Walgreens for our employees. We were at the Trunk or Treat event with the Unity Family Success Center in Irvington. We worked with the Gateway Academy in Newark with a flu clinic and the Cardinal Family Success Center in Plainfield, New Jersey. So all fantastic ways to get people educated and vaccinated. If you would like us to have a table or help coordinate a vaccination event, we'd love to come to you. Please be in touch. We're always looking for creative ways to reach the community. And now I'm going to turn it over to Dr. Esni Sharp, who is going to introduce our community updates. So give me just a second. I'm going to stop sharing my screen here. Okay, and Dr. Sharp, I believe you are here.
Yes, I am. I'm here.
Okay.
Hello,
Welcome.
everyone. Hello, everyone, and welcome to our EMIC, our December end of the year EMIC meeting. We are so very, very grateful always to all of the members of EMIC and all the great, amazing, and incredible work that you're doing in our communities. We appreciate you, and especially to our presenters today. Thank you so much for coming into our forum here and presenting some amazing and really very vital and important information, educating us. We appreciate you taking time out of your schedule and being with us today to present. Leanne, we're so very happy for you in your new role, and it looks as though you are doing excellent. We appreciate you, all the members, and myself and Dr. Swab. We appreciate the hard work that you're doing and keeping everyone connected and so forth and so forth. If Emily is on the line, hello, Emily. It's good to see you. I just want to open the floor for all of our members who are here today. If you're a new member, if this is your first meeting, we want you to just say who you are, introduce who you are and what agency you represent, or what community you represent. And for our existing members, we would like for you to give us any updates you would like to share with us about what your organization is doing in the community. If you can, there's no type of order here. You can just please chime in at this time. We have a couple of minutes, so anyone new or any of our existing members have anything they would like to share?
I'd like to touch base on Step Up Vax Up if I can take the floor real quick.
Yes.
So I just posted it in the chat. My team from PMCH, we work on the Step Up Vax Up Campus Health Awareness campaign. It's a contest that's open to all New Jersey college students. It's a campus health awareness campaign focusing on digital content creation. So students can create videos, TikToks, Instagram Reels, podcasts, posters, flyers, anything that's digital, and submit it to our contest. They have to choose between 4 vaccines: flu, COVID, HPV, or meningococcal, and they choose one of those vaccines to create content on, educating their community and their peers. The deadline's April 30th, 2024, but we are currently accepting submissions. We have an early bird prize that's typically just to incentivize students for submitting early. So that's due March 18th. Our website is also on the flyer in the chat. They can submit right on the submission tab. And if you'd like my team to come and present to your organization, or even set up a table, hand out merchandise, talk to students, or your community members, you can email me at the email, either on the flyer or the one that I put my personal in the chat, and we can organize something like that for the community.
Thank you. Thank you.
Thank you.
Anyone else?
Hi, everyone. My name is Melissa Hart. I'm the program manager for immunization initiatives at the partnership. So just wanted to share Protect Me with 3. It did launch earlier this week. So we are already getting submissions. So we're very excited about that. But for those who are not familiar, it's a collaboration with New Jersey Department of Health. It's for 5th to 12th graders to enter either a poster or a video on an adolescent vaccine of choice. So they have 5 different options that they can choose from. There's prizes. We have an award ceremony. It's a really great and creative way to get students involved. So I will put that information in the chat, and I do encourage you to share it with any contexts that serve youth. So it can be school contexts, religious youth groups, Girls and Boys Scouts, YMCAs, Boys and Girls Clubs. So any particular organization that serves that population, and we will be accepting submissions to February 16th.
Thank you so much. This is one of my favorite initiatives that it's attached to EMIC. I love the Protect Me with 3 since we started. It is really such a wonderful thing to get our children involved, as well as education. Leanne, would you please send out an email to me, if you don't mind, regarding Protect Me with 3, or the contact person?
Absolutely.
I know you're the contact. What's the young lady name that just spoke again?
Melissa Hart is your contact person. Yep, she is here. And we will certainly get that information and share it. And please, we appreciate sharing it far and wide.
Thank you. Yes, that's what my goal is, to share it around. Is there anyone else that would like to give us good news or anything that you're doing in your organization that you want to share with our members and attendees today?
Yes, hi. My name is Brianne Bozeman Sims. I'm sorry for the noise in the background, but I'm the health educator at Union County Office of Health Management with the County Health Department. I've worked with Melissa and Ureni and Emily and Jasmine before. We're partners with the partnership through our Regional Chronic Disease Coalition of Middlesex and Union. And we've done a lot of things together, but there's actually 2 events that we're having that are coming up this month on and I have to look at my calendar because I mix up the dates. So on the 14th of December at Elizabeth Public Library, we're doing a coat drive and a care package giveaway for the homeless population that gathers around the library. So we're asking for coats, any other, winter gear that anybody might have, you can drop it off. Our office is in Westfield, so it might be a distance for some people, but if anybody wants to come out and support, if the partnership would like to have a table at the coat drive, they're more than welcome. And then actually on the 15th, we are working with Proceed, which is an organization in Elizabeth that serves the community in various ways. We're doing a lead screening and flu vaccine clinic there on the 15th between 10 a.m. and 1 p.m. So I've already worked with Amy Ferry, who I know is a leader on lead prevention. So again, we're going to invite her again and anybody else that would like to loop in as well.
Melissa, thank you so much for sharing that really good information. Would you kindly put your phone number in the chat?
Yes.
Anyone else would like to share?
Hi, good afternoon, everyone. I don't have anything to share. I just want to introduce myself. So my name is Jonathan Banks. I started with the partnership at PMCH a few weeks back, and I'm the new NJIIS program supervisor. So I have the pleasure of stepping into Leanne's former shoes now that she's moved up. And so, yeah, it's a pleasure.
Good to meet you. Welcome. Welcome to your new role.
Thank you.
Anyone else?
Hi. I also don't have anything to add. I'm just introducing myself because this is my first meeting. I am the new outreach and education specialist with Step Up, Vax Up, and I'm so excited to be here. There's so much information that I learned today. So thank you everybody for that.
Thank you.
Good afternoon, everybody. I don't have nothing to share, but I just want to introduce myself. My name is Maria Luisa Solis, and I am the Community Alignment Specialist for Passaic County, and I am here learning about what other roles the partnership does to our community so that I can continue promoting all the programs. Thank you.
Thank you.
Dr. Sharp, I'll just remind everybody about the Docket mobile phone app. You know, we talked a lot about talking to our patients and clients about immunizations today and an immunization schedule. If the clients have access to a smartphone or a computer, they can access their immunization records on the Docket app or the Docket website. It has, as long as their vaccinations are in NJIAS, it will show up in Docket. It will also tell them when they're due or past due for immunizations. So giving them the knowledge that they need to have a conversation with their doctor about due or past due vaccines.
That's good information. Thank you so much. Modern technology. Well, I'm the CEO and president of Bessie May Women and Family Health Center, longtime partner with the partnership and with IMIC. And our organization just celebrated our 10th year anniversary. I want to thank Mary Carl and Dr. Schwab for attending the event and giving such great and wonderful words to our center and about our relationship. Thank you so much for all your support with that. We are navigators for the Get Covered New Jersey. So we help people in New Jersey enroll with their health insurance enrollment assistance. And so if anyone on the line need for us to come to your location to help enroll or to provide information, education to some of your clients, we are happy to make an appointment to come. If you're hosting any events, and Melissa from Union County, that's the reason why I wanted you to share your contact information, because we would love to partner and be a part of the events that you have coming up. we also just recently opened our health center in Union County. It's on Tucker Avenue in Union. And I now really need to talk to Melissa so that we can work closely together, serving our community. And that's all that we have coming up from the Bessie Mae Women and Family Health Center, except for our holiday party, which I can't wait to have. And so thank you, everybody. Thank you so very much for working with your communities and making time in your schedule to be at these meetings. It's the end of the year. I always love this time. We want to especially thank Dr. Schwab for being our leader for EMIC, and also the leader for partnership as well. He's doing a dual role, and amazing man. Thank you so much. We look forward to lots more coming up in 2024. And I just want to say, reiterate to you, please share with people to attend our meetings, even if they don't want to become a member. Please just attend and get all this great information from these presenters and everything that we have to offer throughout the year next year. Again, happy holidays to everyone. And I'm going to turn it back to Leanne now.
Dr. Sharp, thank you so much for those kind words, and congratulations to you and your organization. And you do amazing work. So what a great way to close out. I am actually going to turn it over to Dr. Schwab to officially end our meeting. Thank you so much, everybody.
Okay, and thank you, Dr. Sharp. Thank you, Leanne, for leading this meeting, getting it all organized, and it was a great job. And thanks to all of you for attending and for your good and hard work. Happy holidays to everyone, and we look forward to seeing you again in the new year. Those of you who like to join the working groups, we'll meet with you in February, and then our next quarterly meeting will be in March. So we'll send out the dates and the details of that as we get a little closer. So all the best to all of you, and thanks again for being here today.